Hello, everyone, and welcome back. I'm trying to upload more consistently, trying to at least be somewhat keeping to my word here on adapting to anxiety. I appreciate you tuning in as always. Not really an update video, not a reaction video either. This is just a different style of video I'm going to attempt to do because I did talk about doing this in my initial video. I want to cover some anxiety news or reports and studies, things that come out. And I scrolled through what's come out over the last couple of weeks, and I found this to be the most interesting one. So I'm going to read this, maybe not line for line, but I'm going to hit some of the highlights, and I'd like to just give my perspective on it and see what I make of it. I haven't fully read the article yet, so I'm interested to see what this is all about. I've read the headline and a couple of paragraphs. So let's get into it, and then feel free, let me know in the bottom in the comments what you think of this, if you think this is potentially something that is helpful, or if it's something that you would even attempt, or if you're going to stick to what you've been doing. So let's go ahead. Study demonstrates an effective technology-driven alternative to psychiatric medication for social anxiety. So there was a new trial done at Tel Aviv, I'm not quite sure how to say that, university that has demonstrated an effective alternative for people with social anxiety. Gaze cognitive music reward therapy. All right, now 50% of the participating patients had their symptoms relieved. This is interesting, all right? But before we start talking about what this could mean or what the ramifications of this are, if this is going to actually be something that you or I could possibly take advantage of, let's go over exactly what they're saying here. This is just kind of going on about what social anxiety is. Of course, if you're here, chances are you're already familiar with it. You get anxious in social situations. You overthink things, absolutely. A couple of the treatment options, talking about SSRIs and CBT, which is cognitive behavioral therapy. I've been through I'm actively doing both of those. And those have been kind of the go-to methods for several psychiatrists and therapists for quite some time. But their argument here, CBT is demanding, expensive, and not readily accessible. People turn to medication. Medication has its own drawbacks. You got your side effects, the absolute torment that can be finding the right one for you. And sometimes, even if you get past all that, there are other medical conditions you could have that would prevent you from taking the medication. So, this is the juicy stuff right here. Now researchers from TAU have developed a third option, which is easy to use, quick and simple, and apparently no less effective than psychiatric drugs. Moreover, since the treatment is highly patient-friendly, a much lower dropout rate may be expected. In the clinical trial, 105 Israeli adults with social anxiety disorder were assigned into three groups. One group treated with SSRIs, second group treated with the GC-MART or GC-MART, and then a control group. They did 10 30-minute training sessions. 50% of the patients provided with the new therapy demonstrated significant improvement in their symptoms, a result similar to the outcome reported for the patients who took Cipralex. And then from the professor, the therapy we developed is based on eye tracking, combined with a musical reward. The patients choose the music they would like to hear, Israeli, classical, hip-hop, etc., and is shown a simulation of a crowd on a computer screen. Usually, individuals with social anxiety disorder tend to dwell on scowling or threatening facial expressions, quickly picking them out and unable to look away. Consequently, they often interpret the crowd or social situations as hostile, negative, or critical. People without social anxiety disorder, on the other hand, prefer to focus on the positive or neutral faces in a crowd. In the new therapy, the music chosen by the patient provides positive feedback for a normal focus of attention on facial expressions in the crowd presented on the screen. Gradually, through training, patients' biased attention is normalized and symptoms recede. All participants in our trial underwent a comprehensive clinical assessment both before and after the treatment and were also asked to report on the symptoms and their severity. Results indicated that the new treatment significantly reduced symptoms of social anxiety with an efficacy that is similar to that of SSRI drugs. Okay. You can read on the screen, what they concluded if you want, but this is... on one hand, it's interesting, but I would be lying if I said I wasn't a little skeptical of it. And to be fair, I was the same way with medication. Before I ever put any of those pills in my mouth, I kept having recurring thoughts, this isn't going to work, this is dumb, you're going to become dependent upon drugs, whatever. So I guess an argument could be made that maybe that does exist for almost any treatment method, but this is highly unique. At least as far as I'm aware. If you've heard of something else like this, let me know, because I'd be curious to look into it. But this is, I'm not going to call it like a breakthrough or anything like that, because it's the same efficacy as a SSRI. But what I find most interesting about this is this sounds like something that you could almost simulate or do on your own. You pick your favorite genre of music, pull up a picture of a crowd, and I'm sure there's more to it. This is being done by professionals, but I just found it so interesting that this is having that effect. Like, is it the music that you're hearing? First off, I'd be interested to get more information. Like, is this them just picking their favorite music and bands and whatever, and then just looking at an image of a virtual crowd? Because if that's the case, I feel like maybe if you have like an emotional connection to a certain song, certain band, or even a certain genre of music, maybe that coupled with you not being in an actual crowded room with people is maybe just lulling people into this false sense of security. But I don't mean to be overly critical of it. If these guys, I know they're in Israel or wherever, but if they came to me, I would totally try it. I would try anything if it meant furthering the research and study, because I'm a sufferer of this, and this is something that I would want to see everybody hopefully get, treatment, or at least make their life better for, because it is not the greatest. Let's be real. Social anxiety sucks. It's not a condition or a disorder that you want to be afflicted with. And I also would be curious to see this maybe combined with the CBT. So what happens if we take the patient who's suffering from social anxiety and we give them, earbuds or headphones, and we put them in a real environment that is like a kind of a club setting or like a stadium setting, surrounded by people, room full of people. What would we see then? That's going to spike their anxiety, but if it's the music that is actually helping, would we see their symptoms reduce as well? Would they, when they're being analyzed, would they report that their symptoms are less severe? Or is there just something else going on in their mind where they're listening to the music, they're seeing the faces in the crowd, they're improving, and then they don't need the music, right? So if we go stick them in an environment that is very similar to a crowded room or a stadium or whatever, but with no music, would we still see an improvement? And furthermore, what if you pair this with the SSRI? Is it possible that we could get even better? Like someone like me, I'm not on Celexa, but I'm on Lexapro. Would I see benefits from trying something like this? These are all, obviously this is very new. I'm a skeptical person by nature. I like asking a bunch of questions, but I'm also very fascinated and excited by this. Even not necessarily this, but just that there are still new methods being tried. We're finding new ways to help treat. Even if one person out there genuinely benefited from this and they found that their life was easier, or if they had any way to improve their circumstances thanks to this music therapy, then I'm all for it. And it does not sound like it's expensive. It does not sound like it takes a lot of time. It's a step in the right direction for sure. So let me know what your thoughts are on this. What are they calling it? GC Mart, which stands for, what was it? Gaze Cognitive Music Reward Therapy. Let me know. I mean, would you try this? I would be. It doesn't sound like there's really any harm in it. Would you, if you're currently on medication, is this something you would supplement with or possibly even do instead of your regular medication? I'm very interested to hear the response on this, and I'm very interested to see where this goes. If there are further studies done, or if this kind of just fizzles out. I appreciate you guys watching. I do hope you have a great rest of your day.